Randomized controlled trials, also known as RCTs, and how to filter by article type. What makes articles different from each other? Articles may all be structured similarly, but one of the things that make them different is the type of studies that they describe. What we mean by that, or what we mean by article type, is that we're talking about the study design or experiment the article describes in its method section. You already had to look this up in some of the articles that you've analyzed for this workshop assignment thus far. But what we're going to do today is teach you how to find these different types of articles using our databases. We know for a fact that this is something that you will have to do in the nursing program as we move forward through the rest of your classes. Let's talk a little bit about RCTs. It's short for randomized controlled trial. This is one of the most highly regarded experimental designs and studies because of the randomization and then the control in the study that they have. RCTs are used to determine the effectiveness of interventions, whether that be like drugs, like an educational program, maybe a different type of therapy. And so really, really highly regarded studies because of the randomization. And we'll talk about that in a little bit. A lot of the times, RCTs can also reduce the bias in the researchers and the subjects, especially if they apply blinding. So it might be single blind or double blind. If it's double blind, it means that neither the researchers or the subjects know who's getting what kind of intervention. Here's a basic RCT setup. You'll start with test subjects, all of them who are either sick or experiencing a condition. The test subjects are then randomly split into two groups, and this is a randomization in randomized controlled trials. And then each group is given a different thing. So one is going to get the intervention, and so the intervention can be either the new drug, it can be a new education program, it can be something new, something that we're testing. And the control group is either what's already been used in practice, so maybe like an old medication or a classic drug, might be a different drug, might be two different drugs that they give. It might even be placebo, or they might not even get anything at all, the control group. So this is where the randomized controlled part comes in. One group receives intervention and the other group receives a control. And then we start to see if people's symptoms or condition is improving. And you'll see that in the intervention group, more people symptoms or conditions improved, but you'll see that in the control group, there were also people whose symptoms or conditions improved despite them not receiving the new intervention. And so researchers will want to look at why that happened and why these people got better, but they'll also want to look at the people who stayed sick, even though they got the intervention. And so all of this are results, and this is evidence. The authors, or the researchers, will go ahead and write a manuscript, and they're going to write their article, and they're going to publish it, and that's evidence that we can use to apply in our everyday practice. So let's practice finding RCTs inside Medline. I'm going to start off on our nursing research guide, and we're going to open up Medline. We have our three search boxes again, separated by the word and then all of our filters down here. I'm going to use the example that we have in the assignment set up for you. And so make sure you spell everything correctly, geriatric, and I'm going to use this one. It has a lot of other keywords like elderly, aged, and actually aged is the word that our database is used to describe geriatric patients. And then I want to look for research that contains elderly and pneumonia. So I'll just leave it at pneumonia. Now I'm going to go down to my filters, and I'm going to check off the peer-reviewed filter because your professor wants you to look for peer-reviewed materials. And then I'm going to look for the publication type, and this is where you can find different article types. I'm going to scroll to the R's because I know I'm looking for a randomized control trial. So I'm going to select randomized control trial, and then I'm going to click out into the white space so it saves my option. I'm going to go back, I'm going to go down here to search. And I can see that I have two filters applied. If I click on them, we can see they're applied here. I hit the X, and then my peer-reviewed filter is on. And so I can be sure that everything I'm looking at here is a randomized control trial that is peer-reviewed. Now, some of them are really great because it says, randomized controlled study. It's the same thing. Some researchers prefer to use the word study than trial. This one you can see is double-blind. Perspective means it's looking forward into time. Some of them don't even say it's a randomized controlled trial. However, if you click on the title of the article and we look at the record, if we look at the publication type, randomized controlled trial is listed under publication type or article type. And if you want to access it, you can just click Access Now and it'll check for a PDF. To answer question 2, I use pneumonia as a condition, okay? So what you're going to do is find a randomized control trial for the geriatric patient and one condition from the problem list in the case study. I use pneumonia, so make sure you use a different problem to answer question 2. We want you to give us the article title as well as the journal title. Remember, you can find the journal title under source. The year, the purpose of the article, the research method. This is going to be in the methods section. The subject, so how many people were in the study, what were their demographics, and then the results, finding or conclusions. You can copy and paste some of the information from the article. However, remember that you're turning this into your professor, so you might want to change it up a little bit wherever you can. If you have any questions as you move through the assignment, please email me or Kristen Perales directly. You can also visit bit.ly/asknursing to populate that form. That'll send you an email on your behalf, so you don't have to log into Outlook if you have any questions. We'll talk more in the next video.